We're managing brain injuries, not treating them. A child hits their head, and years later, they're still dealing with the consequences. Sleep problems, behavioral issues, cognitive changes, and we call that expected.
Hello, I am Dr. K. Paul Stoller, and I have been treating children and adults with traumatic brain injuries since the turn of the century using hyperbaric oxygen. I was the first to start treating NFL players with TBIs and CTE, and the first to discover hyperbaric oxygen could cure fetal alcohol syndrome. And yet, despite a plethora of peer-reviewed scientific articles, hyperbaric oxygen remains the Cinderella of modern medicine and is ignored. Every few seconds, someone in the USA gets a TBI, and yet a safe, efficacious therapy is ignored.
A new study in JAMA Network Open confirms how fussed up we are about brain injuries. After mild traumatic brain injury, children are significantly more likely to develop chronic sleep disturbances. And those sleep problems, they're strongly tied to behavioral dysregulation. So what do? We normalize it, we manage it, we adapt the child to the injury. The playbook is predictable: sleep hygiene, behavioral therapy, medication if needed, step by step, layer by layer, treating symptoms. But here's the problem: none of that answers the core question. What if the issue isn't sleep? What if it's an injured brain that hasn't recovered? Because when brain metabolism is impaired, when oxygen delivery and utilization are disrupted, you don't just get one symptom. You get a cascade: sleep disruption, emotional instability, behavioral change, all downstream. There is a therapy designed to target that level to support brain metabolism, to improve oxygen delivery, to help restore function. Hyperbaric oxygen therapy, used for decades, studied, observed in clinical settings across a range of brain injuries, and yet, not part of standard care for TBI. So the obvious question is, why? If brain injury drives sleep disruption, and sleep disruption drives behavioral problems, why aren't we aggressively pursuing therapies that target brain recovery itself? This isn't about a lack of need, it's about a lack of alignment. In medicine, adoption doesn't happen just because something works. It happens when multiple forces align: large-scale funding, repeatable trials, institutional momentum, and economic viability. If a therapy doesn't fit that model cleanly, it doesn't move forward easily, not because it's disproven, because it's inconvenient. And while that process plays out, children adapt to dysfunction, families adjust expectations, and symptoms become the new baseline, not because nothing can be done, but because we've decided what's standard.
This isn't about rejecting conventional care. It's about asking a better question. If we know the brain is injured, why are we so focused on managing the consequences instead of restoring the system?
At some point, we have to decide: are we treating brain injuries or just getting better at living with them? When the man on the street learns what hyperbaric oxygen can do for those he cares about and demands HBOT for TBI, then and only then will hyperbaric oxygen become standard of care.